Hi, everybody. It's Dr. Barron here from the Medical Humanities program. I'm sorry I can't be with you in person, but I wanted to record something for you to greet you and thank you for your interest in MLK and tell you some about the Family Health Center in general so you can understand what a great opportunity this is for service for your organization. First of all, you need to know that the Family Health Center consists of the residency program. This is the main site on 18th and Colcord or thereabouts. Consists of the residency program and several satellite clinics, of which MLK is one. So MLK is one of the many satellite clinics where we have doctors, nurse practitioners seeing patients. At the main site, you might see people that look like this. These are the residents, and these could be you. All right. Okay, in a few years, this could be you. And that's why I'm anxious for you to get involved with the Family Health Center so you won't be like me and not have known anything about the program. What you need to know about the Family Health Center is how incredibly influential it is. Just because we're in Waco doesn't mean that it doesn't have massive statewide and even national influence. Let me show you another pic. All right, see this person in the blue? I don't know who she is. See this person? Barack Obama. This person right here, that's Roland Gertz, and he is the Chief Medical Officer of our organization, standing right behind President Obama when he signed the Affordable Health Care Act. Dr. Gertz was recently president of the American Academy of Family Medicine, and so that should give you an indication of the kind of influence and connections we have here, even though we're in the heart of Texas. As far as the residency program goes, it was started in 1969. It's the oldest family medicine residency program in the state. It's the oldest family medicine residency program west of the Mississippi. We take 12 residents per year. This past year, we had 700 applications to our program. We granted 100 interviews and offered only the top 12 slots. So that gives you an idea of how competitive it is to come to this program. And I want to make sure you know about it where you are now, so that you won't be like me when I was a medical student out in some area outside of Houston, and one of the doctors says, "What are you going to do?" And I said, "Well, I'm going to do family medicine." And she said, "You need to go to Waco." And I said, "I just came from Waco." And they said, "No, you need to go to the residency program in Waco." And that's when I started learning what an amazing place this is. Okay, here's something else. Uh-oh, I don't think this is working. I think I should have printed it backwards, but it says Epic. All right. So the reason I say this is because we also have one of the state-of-the-art electronic medical records programs, one of the very top programs. Think Apple for personal computers. Epic is that for electronic medical records. And so again, just because it's Waco and just because you're going to be at a clinic that's right up here that kind of looks kind of isolated in the middle of a cornfield and some apartment complexes around it, don't think that you're not in a very special place. Here's some pictures of the residents. And I show you this because these could be you in just a few years. For those of you who are interested in primary care, just remember I sat right where you're sitting. Well, actually, I didn't sit right where you were sitting. I was at Sid Rich in a basement with no windows, dank, dark, damp. And so you're actually sitting in a much nicer place than I was. But the point is, I was a pre-med student just like you, did my medical school years at UT Houston, which is fabulous program. I highly recommend that medical school. All the UT schools are great. And came back here and did my residency here in Waco, Texas. So that's a little bit about the Family Health Center. The MLK site is very special because of a pediatrician working there named Dr. Floyd Berry. Also, there is Dr. Isaac Lippy and a nurse practitioner named Kate Sims. And in addition to that, another name you need to know is Shelley Copeland, because Shelley Copeland is Dr. Berry's nurse. And we all know who really runs things is the nurses. Don't ever forget that. So you need to know Shelley's name because she's the main contact for your organization. The vision of having volunteers at the Family Health Center has to do with the fact that this is why I am created and why I am on the planet, is to build bridges between the Family Health Center and Baylor University. And so I would lay awake at night trying to think of ways to get pre-med pre-health students as volunteers in the clinic because I know what an incredible place it is. And so we started with AED and the South 18th clinic, and the project has been so successful that we want to offer that opportunity to your organization. And there's just no limit to the potential in a partnership with your organization and this clinic. And that's going to be very individual and personal, and it's going to evolve as you all serve there. But the main point of volunteering there is service. I want to emphasize that. I know every pre-health and pre-med student wants to shadow, but what I want to emphasize is service. That is, after all, the name of your organization. And so one example would be, this was a book drive that we did in the Medical Humanities program with some journalism students, and we were able to take this big basket of books over to the MLK site, and you can see some of the staff there. There's Stacy, and Shelly's not in here, but you'll remember to learn their names. That's just polite, all right? All that to say, there's service opportunities. There are also, it's very possible that some research opportunities could grow out of this. I've had some students do some class projects in it, and there's also the potential for, just the potential for shadowing is there, but the most important thing is service. Service that's real, that matters, that's sustainable, that's continuous, that you have an ongoing relationship with this clinic, and it is just going to be a tremendous benefit for both you and the Family Health Center, particularly MLK. And I just ask you to do your very best and want to remind you that no matter where you are, no matter what you're doing, whether anyone is looking or not, you need to be at your best. And this is an opportunity for you to learn about medicine, and it's an opportunity for you to learn about how clinics run, the various healthcare professions, and it's an amazing opportunity that I didn't have when I was sort of sitting where you're sitting, but you're going to have. Remember that you are young pre-professionals, and we expect you to behave that way, act that way, dress that way, carry yourselves that way. Make a good impression, because you don't know what the future holds, and you may want to come back to Waco to this residency program, and it'll be great if we're able to remember you. So I wish you the best. I know this is going to be a great partnership, and if there's anything I can do to help support and sustain it, you let me know.